From WNDU, your breaking news and weather authority, this is News Center 16 at 5:30.
Good evening, I'm Maureen McFadden. When you're faced with a medical problem, getting the right care is the #1 priority. But one visit to the hospital can mean bill after bill from different specialists and for a range of services. Now one pilot program aims to make that easier. News Center 16's Gabby Gonzalez joins me live from the newsroom. So Gabby, how does this program work?
Well, Mo, it's all about streamlining the bill pay process. Instead of patients getting dozens of notifications and bills, then, for instance, Medicare paying each of those bills separately, Medicare will just pay the hospital for services, and then the hospital will handle paying each of those individual bills. It's something that could help cut costs and allow patients to get a better understanding of the services they're getting. Manuel Navarro sees plenty of patients in the financial counseling office.
I wonder if you could possibly help me with this.
Many coming in with a stack of bills, stress, and confusion. A formula that makes understanding the numbers on the page even tougher.
So I sit down, I explain to them, that doctors bill separately, anesthesiologists, radiologists, so they'll receive multiple bills.
But soon, many of the patients that walk through the doors of St. Joseph Regional will have less paperwork to deal with.
This is an effort to chip away at every element of cost that there is, and at the same time make business sense for both patients and healthcare providers.
It's all part of a pilot program, a facet of healthcare reform.
The Affordable Care Act does a couple things. It's out to insure more Americans, and the only way that that is possible is by reducing overall costs.
An approach that Gutierrez says will add up in the patient's favor.
The more that you could bring the billing process close to the point of where the consumer is, the easier it is for the consumer to A, evaluate what occurred, and B, what could have possibly have gone wrong in the bill.
The hospital acting as the distributing point for payments.
Think of your grandmother. If she were to slip and fall out in the community and come to the emergency room, bill from the emergency room doctor. She has a broken bone and has to have her hip replaced, bill from the orthopedic surgeon. So this is an attempt to reconcile all of that and to allow the hospital to be an intermediary.
And while the pilot program is focused on those with Medicare,
the private insurers will look to this as a best practice. If we could unravel the spaghetti of Washington and Medicare, we could do it with a private payer.
Now, this is a 3-year commitment for the hospital. First, it's an assessment of how things are currently done, then rerouting the information that goes to the patients, and then actually starting putting this new approach into practice. At the end of the 3 years, the results from the 500 participating sites will be discussed in Washington, D.C., and at that point, it's up to lawmakers to decide if this should become a nationwide policy. Mo?
Hey, Gabby, so how did St. Joe Regional Medical Center get to be one of the sites for this pilot program?
Well, no, there was actually an application process for this. They had to commit to the program for 3 years and also show that they met the federal guidelines. But Gutierrez says they were eager to be hands-on to figure out ways to really cut back on the health care costs.
Okay, good to know. Thanks a lot, Gabby.